Hi everybody. Now we're going to discuss vitamins and minerals. I'm not going to do a PowerPoint for this because I know that you've had this in your dietary courses, some in probably your anatomy and physiology. So we're just going to go through this quickly. But I do want you to know that there will be board questions on mainly vitamins C, A, and D are probably the most common ones. But so let's just kind of briefly go through this, okay? So let's see here. Measurement of vitamins needs. Here I just want you to know that there is the recommended dietary allowance, and that's kind of just a generic thing, measurement that meets the needs for 97 to 98% of healthy people. So it's not necessarily for everybody, but it's a good starting place. Okay. Water-soluble vitamins. So water-soluble vitamins basically don't stay in your system for a long period of time. Okay. So the first one is vitamin C. You can see chemically is sugar acid and readily undergoes oxidation to form dehydroascorbic acid. Sources, we all know that citrus fruits, green peppers, tomatoes, strawberries, broccoli, lots of fruits and vegetables, okay? Recommended daily allowance for a female is 75 milligrams to 90 milligrams for a healthy male adult. Readily reversible oxidation reduction system is the role, and also plays a definite role in connective tissue metabolism because it's required for the formation of collagen. The deficiency is scurvy, and I have actually pulled up scurvy so you can see it. I don't know if I can get this picture any bigger. But you can see here, you know, the tongue is real red. Look at these patches here. Sometimes interpreted as mental illness. You don't really see any of these deficiencies much in the United States. They're more in underserved, or I shouldn't say underpopulated, but third world countries. Okay. Functions of vitamin C include the following: collagen formation. Of course, that's important in dentistry, that collagen. So we want to know that. Synthesis of epinephrine and norepinephrine. Synthesis of carnitine, a protein that facilitates transport of fatty acids to the mitochondria for beta oxidation. Defective connective tissue formation in vitamin C deficiency would be impaired wound healing, inadequate response to infections, alterations in the integrity of the capillary walls. So you'll get more hemorrhage. Hemorrhage in the skin. In fact, let me show you here. I'm sorry, this was pellagra. Oh my gosh, I'm so sorry. Scurvy. This is the scurvy. And again, you don't see it much in the US, but Okay, let's see here. I don't know what's all going on here, but there we go. Look at this really puffy. This is the bleeding under the gums. Looks really like a severe case of maybe a type 2 diabetes or something like that. But you'll see this change, and these would bleed really easily. Okay. Let's go back here. I apologize for that scurvy mix-up there. Apparently I've looked at too many pictures today. So adverse reactions, untoward effects have been reported with the use of mega doses of vitamin C. A daily intake of 1 gram of vitamin C may cause precipitation of oxalate stones in the urinary tract. So this could be a cause of kidney stones. Now, there are different kinds of kidney stones, and sometimes vitamin C helps, and sometimes vitamin C hurts. So not all kidney stones are from too much vitamin C in the system. Interesting enough, my husband just passed a kidney stone yesterday, which is part of the delay here. So as long ago as 1942, the suggestion was made that vitamin C could be therapeutically beneficial in preventing the common cold. Now, I really want you guys to know and understand this right here, this clinical consideration. However, if we go down here, in the end, based on current evidence, unrestricted use of ascorbic acid or vitamin C for these purposes cannot be advocated. So they have not been able to prove that this is a good treatment for the common cold. And I know people still do that today. Take a lot of vitamin C when they have a cold. What is that? I think there's one that people take right before, Airborne. And then I think there's like a vitamin C packet also. I'll bring some to class if I can find some. I think we may have some here. B complex vitamins. A lot of people take the vitamin B for energy. It's very, very common for people actually to take them for energy. People take them in the morning, and it seems to give them what they need to get through the day. So number one, those that primarily release energy from carbohydrates and fats. Those that, among other functions, catalyze the formation of red cells. And that's the folic acid and vitamin B12. And those that have not been shown to be required in human nutrition, and that's the choline and the inositol. Thiamine is converted in the liver to act as an active coenzyme form of thiamine pyrophosphate, TPP. Okay. TPP plays a principal role in the intermediary metabolism. So again, giving people a little more energy, a little boost in their metabolism. Now the deficiency, I have a little note here, just a kind of a side note, is the beriberi. And that was pretty common in World War II in the concentration camps, and then also the prisoner camps in the South Pacific, where they have peripheral neuritis, muscle weakness, paralysis of the limbs, enlargement of the heart, and tachycardia and edema. Okay, so you know, this was really serious during the war. Let me just see here if we can pull up some beriberi here. I hardly want to even show you these pictures. But here is beriberi due to vitamin B deficiency. Okay, so it looks like little berries all over. But you can see in some of these smaller pictures, and I don't even like to believe that humans are that cruel, so I won't pull those pictures up. But like I said, it was pretty rampant due to the malnutrition of the prisoners, whether it was prisoners of war or the Jews. Okay. So, let's see here. Thiamine is usually non-toxic, even in large parenteral doses. However, in patients who are hypersensitive to thiamine, I'm sorry, I know how to pronounce these. For some reason, I always have a hard time during these recordings. Pruritus, sweating, nausea, respiratory distress with hypotension. So again, sweating, nausea, respiratory distress with hypotension. That's a lowering of the blood pressure. Vascular collapse and death have occurred. This is if they're hypersensitive. So clinical considerations, a wide variety of manifestation, and the deficiencies include beriberi and peripheral neuritis. Riboflavin, or vitamin B2, and I'll probably have a matching, some sort of matching the name of the vitamin, so the riboflavin, along with which vitamin it is. Okay, this is again still water soluble. The RDA is 1.1 for adult women and 1.2 for adult men. And it's usually parallel to the caloric intake or metabolic body size and what they need. Symptoms of riboflavin deficiency usually involve the lips, tongue, and skin. And so you'll see sore throat or angular stomatitis or colitis. It's not colitis, chylosis. I've heard that pronounced about 5 different ways. Appearing in it as an alteration, painful fissuring of the corners of the mouth, and early and frequent findings. Okay, so if you see something on the corner of the mouth, ask, ulcerations there, ask about their diet. Make sure they're getting their vitamin D. Again, most of these are not real common here in the U.S., but you never know where your career is going to take you, so you definitely want to know these. And you may be working in a community clinic and seeing homeless people and all sorts of stuff like that, so you want to know these. Niacin is vitamin B3. Nicotinic acid. My husband always likes to say that. Niacin, good sources of niacin are in lean meats, fish, liver, poultry, legumes, and whole grains. Now this is where the pellagra comes in. Let's pull that up. No, here we go. So here's the pellagra. I think there's more. There wasn't a whole lot of oral. I mean, you can see here the hands and stuff. It looks like it's peeling away of the skin. You can see it on the hands. Okay. Here's a good one of the tongue. It almost looks like geographic tongue, only it has like a red border instead of a, I guess there's still a little bit of a white border here. But look at that, it looks swollen. And that's as big as I can get it. Okay. Moving on, plays a key role in metabolism. Again, metabolism, energy, that's the reason people take these B complexes. The Krebs cycle is responsible for the anaerobic carbohydrate metabolism and lipid and protein metabolism. Deficiencies is the 3 Ds, dermatitis, diarrhea, and dementia are the 3 signs of deficiency. And then here's the pellagra. Just gonna, like I said, kind of go through these quickly. Vitamin B6, present in most foods of both plant and animal origin. The RDA ranges from 1 to 1.7 milligrams daily for men and women, ages 9 to older than 70 years. The role of physiologic activities, all 3 forms of vitamin B6 are converted to peroxidyl phosphate in the body. Peroxidyl phosphate is the active coenzyme form of vitamin B6 and participates in all metabolic, I think that's going to be a question, probably, that requires the vitamin. Deficiency, cheilosis, stomatitis, and glossitis. Paroxetine is usually non-toxic. When it is given parenterally in large doses, peripheral neuritis may be produced. Folic acid. This is one that is important during pregnancy. And RDA for folic acid is 400 micrograms. That's the MU and G, small g, daily for healthy non-pregnant and non-lactating adults. Of course, that goes up in pregnancy. Okay. Clinical considerations. The administration of folic acid will cause remission of the hematologic effects in pernicious anemia. It will not prevent the neurologic effects caused by a deficiency of vitamin B12. Therefore, folic acid can mask a vitamin B12 deficiency. So B9 can mask a B12 deficiency. Okay, B12. Recommended dose is 2.4 micrograms with an additional 2.6 micrograms and 2.8 micrograms during pregnancy and lactation, respectively. Oral doses between 1 and 25 micrograms are adequate if the gastrointestinal absorption is normal. And the pernicious anemia, a maintenance injection of vitamin D or B12 is recommended once a month for life. The deficiency is megaloblastic anemia. Okay, even large doses of vitamin B12 are usually non-toxic. Diarrhea, itching, urticaria, and swelling have occasionally been reported. If intrinsic factor is given with vitamin B12, an allergy to hog protein may be exhibited. Pantothenic acid is part of all living materials, so egg yolk, bran, yeast, beef liver are excellent sources. And this is, I believe, coenzyme. Coenzyme A. Serves as various metabolic reactions. Some of these reactions involve the transfer of acetyl groups, so 2 carbon groups. Okay. Deficiency, clinical deficiencies of pantothenic acid are extremely rare in humans. They are produced experimentally in humans only by the use of pantothenic acid agonists. Pantothenic acid agonists. It's been used to treat GI tract paralysis after surgery because it apparently promotes GI motility. Biotin, initially demonstrated to be an essential growth factor for yeast, and it was later isolated from both yeast and egg yolk. Biotin is a coenzyme required in metabolism and carbon dioxide fixation reactions. Other vitamin B or B vitamins, there's 15, 17. Really not going to get into those too much. Have been shown to be neither vitamins nor important in human nutrition, so that's why we aren't going there. Fat soluble vitamins, so these stay in the system for a very long time. So doses of these are much more important to watch. Okay, they don't just get peed out easily like the water soluble. Vitamin A, this is one you're going to want to know for your boards. And again, it is fat soluble. Remember ADEK, ADEK are the fat soluble vitamins. Okay, so vitamin A is necessary for normal growth and for maintaining the health and integrity of certain epithelial tissues. Retinoids are found in orange-colored fruits and vegetables. The RDA of vitamin A is 700 to 1,300 retinol equivalents. One retinol equivalent is equal to 1 microgram of retinol, or 6 micrograms of beta-carotene. It's essential for the maintenance of photoreceptor mechanism of the retina. Deficiency would be night blindness. Don't want to be driving if you have a deficiency in this. Now you're going to see more toxicity with these vitamins because they are fat soluble. Hypervitaminosis A is what the toxicity is called. And that's itching skin, desquamination, coarse or absent hair, painful subcutaneous swellings, gingivitis, hyperirritability, and limitation of motion. So again, these are the toxic results. And as for pregnancy considerations, there is a teratogenic effect. Excessive dose of vitamin A and the analogs etranetate are classified as FDA category X drugs. So this is stated in here twice under the vitamin analogs, also category X. Vitamin D. We all know this has been a very important vitamin for people to take, especially people with osteoporosis, because it helps with the absorption of calcium. We often get it from sunlight, but there are also over-the-counter and prescription doses of vitamin D. Right down here, the role is what you want to know. Deficiency is rickets. Toxicity, hypervitaminosis, D, of course, that's just like A, are caused by abnormal calcium metabolism. So toxicity signs of it include weakness, fatigue, headache, nausea, vomiting, and diarrhea. Osteoporosis, again, mainly the female thin white smoker. And definitely go through this. So there's a drug class, and I'm hoping it's coming up later, regarding osteoporosis. But at this point, we're going to kind of go over this. Here's the Fosamax, third generation bisphosphonate, and that's where we see, especially if they're getting this via IV, you're going to see death of the bone, the osteonecrosis of the jaw. And it's been shown to inhibit osteoclast activity and reduce bone turnover. It's taken on an empty stomach with plain water. You can kind of read through that. I feel like this should have a much bigger section. Like I said, I'm hoping that we'll see more in the book. If not, we will be discussing that because it is something that you may come across. Vitamin E. This was kind of all the rage. All these fat soluble vitamins seem to have been all the rage at one point or another regarding heart health and everything. But people, you need to be cautious when they're giving out large doses of these vitamins. They kind of become fads from doctors. They see a benefit and then they kind of overdo it. Functions as an antioxidant. Okay. Vitamin E's are in vegetable oils such as soybean, corn, and cottonseed oils. Other sources are fresh greens and vegetables. The role prevents oxidation of vitamins A and C and protects polyunsaturated fatty acids and membranes from attack by free radicals and protects red blood cells against hemolysis. Okay, deficiency can affect the reproductive, muscular, cardiovascular, and hematopoietic systems. Vitamin E deficiency in male rats has resulted in reproductive failure and sterility. So obviously, we want to be very aware of this. And then it can also lead to fetal death and resorption in female rats. Toxicity is generally thought to have low toxicity levels. Dietary requirements have been administered to human subjects with no apparent adverse effects. Nausea, diarrhea, fatigue, weakness, and rash have only occurred rarely. So low toxicity, although there is a cutoff here, because they saw the benefits of the heart, but then I don't know if it just kind of faded out, the vitamin E or what, but I know probably about 10 years ago it was being prescribed like crazy from cardiologists. Vitamin K, fat-soluble substance, again, ADEC. Vitamin K, what is the thing we know about vitamin K? It affects clotting, right? So vitamin K is essential for the hepatic synthesis of 4 of the clotting factors. Okay, and it has the prothrombin 2, 7, 9, and 10. Deficiency can produce hyperprothrombinemia, antibiotics can reduce vitamin K production. So you want to be conscious of that. Okay. Toxicity, essentially it's not toxic in massive doses. Vitamin K must be administered in large doses before toxicity can be demonstrated. But there is hypersensitivity to it. Anticoagulant drugs such as warfarin competitively antagonize vitamin K and interfere with the production of prothrombin 2 and factors 7, 9, and 10. Vitamin K is the form of phytonadione is used to treat excessive hypoprothrombinemia caused by warfarin toxicity. It's ineffective in reversing the hypoprothrombinemia caused by severe liver disease. I'm sorry, I know these are some words I haven't used for a very long time and they don't roll off my tongue anymore. Okay, and then here's iron. Very important also in the body. Found in a lot of green vegetables, I believe. Oh, here we go. Meats, liver, heart, wheat germ. Okay, so they're mainly found in meats. I thought they were still found in broccoli and stuff, but I guess not. Deficiency, conserving iron. A deficiency can occur only with growth, blood loss, or inadequate intake during pregnancy or lactation. Toxicity, complaints of gastrointestinal distress are common even with therapeutic doses of iron. And if you've ever had a child and had the prenatal vitamins, some people can tolerate the ones with iron and some people cannot. And this is usually why is the GI distress. Zinc, the best sources for zinc are seafood and meat. And they transport carbon dioxide in the blood and eliminate it in the lungs. Deficiency, you can have a change in taste and smell. Toxicity, long-term studies must be conducted to determine the effect of chronic zinc toxicity. Calcium, the fifth most prevalent element in the body, is present in bones, teeth, extracellular fluids. The level of calcium in the serum must be maintained within a narrow concentration to prevent serious problems. And there's the recommended amount of calcium. Calcium is essential for the function of the nervous, muscular, and skeletal systems, and for cell membrane and capillary permeability. Deficiency of calcium can occur when both calcium and vitamin D are withheld. So you can have adequate calcium, but if you don't have adequate vitamin D, it's not going to get absorbed. So that's why calcium usually comes with vitamin D in supplements. Oral calcium may be irritating to the GI tract and can cause constipation. Calcium is used to treat a deficiency of calcium and secondary to low calcium levels. Drug-induced vitamin deficiencies. Drugs from a large variety of drug groups have the capability to produce vitamin deficiencies. Some actually produce a deficiency, whereas others tend to lower the levels of the vitamin, just like the antibiotics with the vitamin K. Okay, so be aware of that. Here's some of the drugs, and then the methotrexate, which is a cancer chemotherapy, but also used with some autoimmune disorders. Isoniazid, what is that again? Tuberculosis. Anticonvulsants, vitamin D. Smoking, vitamin C, did you know that? Alcohol, vitamin B12. Okay, so that wraps that up. Probably very boring because it's just a review of things you already knew. But hopefully just a good reminder for you. So that's that. I will post a PowerPoint from the previous instructor also if you want to look at that.